For years, we've been told that lowering your LDL is the most important thing that you can do. And a lot of pharmaceutical companies do this by encouraging people to use statin medications. Statins block enzymes in our liver that our body needs to create cholesterol. As a result, we have less cholesterol produced by our body, and our liver tries to make up for this by pulling LDL out of the blood. Theoretically, this would lead to a lower LDL in your bloodstream, which again, theoretically, reduces your cardiovascular risk. There are side effects to this medication that may not be worth the benefit. Among them include muscle pain or muscle weakness, fatigue, brain fog or memory issues, blood sugar spikes, and for some, an increased diabetes risk. Statins block the same pathway that produce CoQ10. CoQ10 is a very important mitochondrial nutrient. And so, in theory, reducing cholesterol will actually affect the overall metabolic function in the body, which is counterintuitive to overall heart health when we use statins. It's important that we not look at cholesterol as an individual predictor of heart and metabolic health. What's more beneficial is to look at several areas of blood components and metabolic health and find the big picture. It's also important to look at overall triglyceride levels. And a really great marker of inflammation in the body is C-reactive protein, or CRP. If you really want to look more closely at cholesterol levels, you can look at your LDL particle number, LDL particle size, and you can do this through labs like ApoProtein A and ApoProtein B. Those will reflect the total number of plaque-forming lipoprotein particles, the sticky type of LDL, and this is actually a genetic marker linked to increased cardiovascular risks. Lab work is important, but lifestyle is just as important. So what's your diet like? How many processed foods are you eating on a regular basis? What's your protein intake and your fiber intake like? What's your level of exercise, both cardiovascular and weight training? What is your weight and waist circumference? How is your stress level, and how is your sleep? If you're going to get your labs drawn, I would highly suggest that if they come back a little concerning, start with lifestyle changes before you start using a medication that has no end date in sight. While you're getting your labs drawn, I highly encourage you to get a vitamin D level added on. Your levels should be between 70 and 90 for your immune system to function optimally.